Hi, I'm Dr. Howard Goldberg from the Cosmetic Dermatology and Aesthetic Laser Center in Swampscott, Massachusetts. Today for About.com, I will be discussing the pros and cons of antibiotics for acne. Acne lesions are felt to be caused by bacteria called the Propionic bacteria. In the past, the use of antibiotics in the tetracycline family particularly were very effective in killing this bacteria and very effective, therefore, in treating acne lesions. Sometimes just taking the antibiotic for 1 or 2 weeks would result in very rapid clearing of fairly severe acne. Antibiotics have an additional advantage in that they're very simple to use, just 1 or 2 pills a day. And this can be a very important advantage when a person has fairly extensive acne lesions involving face, chest, and back, and the use of topical medications can be quite problematic to try and cover all the areas. Just taking the pill that gets to the site via the bloodstream is a very simple way of addressing the problem. However, let's talk about the cons with antibiotics. The biggest problem right now with antibiotics is that many of the bacteria have developed resistance to the antibiotics that we use for treating acne because these antibiotics have been overused. This has become a very big problem. In some populations, as many as 75 or 80% of patients are resistant to these antibiotics for the treatment of their acne. Even though when the antibiotics are effective in treating the acne, they can produce other significant side effects. GI upset is a common side effect. In females, vaginal yeast infections also represent a significant problem, although these can be addressed by concomitantly prescribing anti-yeast medication. Doxycycline is particularly associated with photosensitivity, so that during the summer months, patients taking this drug have to be very, very cautious with the sun, or they can end up with a severely blistering sunburn. And finally, minocycline can be associated with lightheadedness, especially if the drug is not taken with food. And rarely, minocycline can also cause a black pigmentation of the skin, especially on the lower legs. Thus, the antibiotics can be very effective at times in some patients with minimal side effects, but in other patients, the drug either does not work or side effects preclude their use, and therefore other methods of treatment have to be employed. But obviously, it's something that one would have to consult their local dermatologist to get further information on. Thanks for watching. To learn more, visit About.com.